So today I'm with Dr. Darrien Rattray from the University of Saskatchewan, and I just wanted to ask you a couple questions about outpatient hysteroscopies. First of all, what would you consider an outpatient hysteroscopy?
There's lots of different definitions depending on where you're looking and in the literature, but it's moving the types of procedures that are traditionally done in the main operating room under a general anesthetic out of that environment. So some people do them in the office, so like actually in the clinic in their regular exam rooms. In the Canadian environment, most of the clinics that are being set up to move hysteroscopy out of the OR are being done in what we call an ambulatory clinic. So these would be clinics within a hospital system that are set up to provide light conscious sedation and then being able to do some minimally invasive hysteroscopic procedures.
And why are we doing this? Why are we moving these things out of the operating room?
Well, operating room time in Canada is hard to come by. Okay, we're struggling more and more within the framework of the Canadian healthcare system to actually get time in the operating theater, as well as these cases are minimally invasive enough that they don't need all of the bells and whistles that are associated with a main operating room theater. The patient doesn't need to be put under a general anesthetic. General anesthetics have risks associated with them. If you're able to do these procedures on women who are awake and conscious but comfortable with the medications that we give them, it's safer for them. And it actually is a way better experience for them as well. It can be really nerve-wracking going into the main operating room as a patient, right? So if you can avoid that unnecessary, unpleasant experience, it actually is beneficial to them as well.
So, it sounds like it's a much better idea to do this as an outpatient. Why don't you think we're doing these more often?
Oh, there's lots of rate limiting steps. I think one of the biggest ones is getting clinics like this funded. Okay, so within the health regions, the health authorities, it has to be made a priority. We have to be, because it does require a startup cost to get these types of clinics going. And we have to be able to convince the health authorities that we work with that this is beneficial to women and it is worth the investment. In some places it has to do with practitioner hesitancy to move these. A lot of places train doing these procedures on patients who are under a general anesthetic, and so it does require a little bit of a shift in thinking in terms of how you're going to do these procedures. So it does require a bit of a paradigm shift within practitioners as well.
Yeah, what do you think interested practitioners and people who are interested in doing what's great for patients, what can we do about the barriers that we experience?
Organizations like CanSage, it's a great start, where we're all coming together as people who do these procedures from one coast to the other and trying to sort out an advocacy approach and how we as the practitioners can push our health regions and try to get these clinics established. Mentorship, I think, is a huge part. So how I mentioned that part of the barrier might be practitioner hesitancy. We can completely eliminate that. We've had, in our clinic in Regina, we've had visitors from coast to coast, Vancouver to Halifax, come out and observe how we run the clinic. And by we, I mean how the nurses run the clinic, and how effective it actually can be, and how these procedures can be done with very minimal patient discomfort. And I think that really helps to encourage practitioners, look, this is possible. And part of the thing that CanSage does a really nice job of is mentorship, right? It helps to foster that notion that, hey, we're all one country, we all want to achieve the same things for women's health, so let's work together and make that happen. So we travel to other places where they're working on these clinics. We help proctor physicians on the types of procedures that can be done in those clinics. So I really think that, having a national organization like CanSage is a really good first step in that process.
Well, thank you so much, Dr. Rattray. That was a wonderful conversation. Thank you for talking to us about this.
Well, thank you for having me.